Hey, this is Dr. Jonathan Yousef. I'm excited to share with you another topic. I've been talking about healthcare series on our last few podcasts, but this podcast, I'm going to showcase some of our activities here in the office that have a little bit more unique approach to patient care. This topic is going to be about trigger point injections, so I hope you guys enjoy. Hi, this is Dr. Jonathan Yousef, networking for your optimal health. Today's discussion is going to be about trigger point injections. There's something unique about the way I do trigger point injections. When my patients are coming in, they usually complain of lower back, mid back, or neck pain. I kind of focus on these because this is where my trigger point injections seem to do the best. But most of my patients, they don't want cortisone injections because that's going to wear out the bony structures and cause degeneration to accelerate. So they're asking, what can I do to actually allow for some healing to occur, or even for some reversal of my chronic pain? And so what I try and do is these trigger point injections. What you'll find in this discussion is that I supplement those with osteopathic manipulative techniques. This combination seems to do it brings a lot more benefits, and I believe that you will enjoy this topic. Hi, this is Dr. Jonathan Yousef, and this is Networking for Your Optimal Health. Today's topic is going to be about trigger point injections. I do a very specialized trigger point injection into people's neck, mid-back, and lower back. And what I use is a product called Traumeel. Traumeel has several ingredients, including arnica, witch hazel, daisy, echinacea, milfoil, and a few other ingredients. The purpose is to allow the T helper cells in the body to reach the areas of pain and chronic pain in particular. So I have many patients who come in with lower back tenderness, weakness, spasms, tension. These can be from bulging discs, herniated discs, or spasms from strains and sprains in their lower back. Many of my patients are very active and they do some sporting activities either during the week or on the weekend, and they need something to help relieve their pain. Typically, they don't want to have a cortisone injection, which is very destructive to the back, but they want something a little bit more natural to help them. So they've tried the anti-inflammatories or the muscle relaxers that are prescribed, and they needed something a little bit more. Well, now I use this trigger point injection. I have a technique in which I will manipulate the lower back, mid back, or neck, or what I would like to call an adjustment. And I use my osteopathic manipulative techniques to adjust these areas. This helps to release the fascia and allow for alignment to occur. And then after doing the adjustment, I will add the trigger point injections. The trigger point injections hold that stability and then also provide nutrients so that the T helper cells and other cells come to that area to repair. My goal is to provide more mobility and greater activity. Sometimes I don't expect that the bulging disc to recover or to be repaired, but what I do want is for the tissue around that area to be as healthy and not atrophy. So when people come to my office, I do a series of osteopathic manipulative treatments followed by some trigger point injections. And this technique, I think, is a very advanced technique for some of my patients in the office to relieve their lower back, thoracics, and cervical. Thank you for joining us. This is Dr. Jonathan Yousef, Networking for Your Optimal Health.